In today's video, we will learn about the coding in emergency services. So it is depend on the managing a cardiac access. So what is the managing a cardiac access? When someone goes into the cardiac access, emergency services achieve a structured term-based response called the code blue. The goal to quickly restore circulation and oxygen to prevent brain damage and death. So what are the EMS responses? In 911 activation, emergency call received, EMS dispatched immediately. Patient identified as unresponsive, no pulse, no breath. Cardiac access protocol achieved. So what are the primary assessment? Internal evolution. The steps follows the ABC's approach. So air is the airway. Check if airway is open. Clear obstructive if present. Breathing. Looks, listen and feel for breathing. Provide oxygen if needed. Circulation. Check cardiac pulses within 10 minutes. So if no pulses, beginning CPR immediately. So high quality CPR. So high quality CPR for a critical services. So rate is 100 to 120 compressions per minute. Depth at least 2 inches. Allow full chest recalls. Minimize interpretation. Disfibrillation. So what is the disfibrillation? So attach AED or a cardiac monitor. Deliver shock in rhythm is shockable. So what are the term roles during a coding? The coordinate terms improve survivals. So team leader directed the interpretation, makes clinical decision, ensure protocol adherence. So airway manager maintain airway, perform interpretation if needed, manage ventilation. So what are EM medication nurses? Establish IV or 10 assessment, administer medication, for example, Ephrin, recorders, documents times, shock rhythms, and check manages. So what is the rhythm assessment? So rhythm assessment are a shockable rhythm, ventricular fibrillation, pulses ventricular, for example, VT, treatment, disfibrillation, CPR and medication. Non-shockable rhythm is the stole or pulses electrical activities. For example, PEA. Medication used in coding. Amphetamine is improve blood flow to the heart and brain. IV fluid is hypovolemia suspected. Advanced airway manager. So bag value, mask ventilation and airway devices. So what are the reversible causes? Provide look treatable causes for assess. So that is the HS, hypoxia, hypokalemia and hypothermia. The TS is the toxis, rethrombus for the pulmonary or coronary, continuous care, continuous CPR cycle, assessment rhythms every 2 minutes, administration medication as scheduled, rotated compression to avoid fatigue, transport to hospital, return to the spontaneous circulation, post resangulation cares. So susceptible airway maintain oxygen saturated, monitor blood pressure, treated underlying causes, rapid transport to hospital. What are the goals for the emergency coding? Restore circulation, prevent brain function, identify a treat causes, establish a patient for hospital care. So today all about this video. So thank you for watching this video.